All right, let's get started. My name is Louise Savari, and I'm the Sales Operations Manager for Care to Translate. And my colleague here, Maya Magnusson, our CEO, is joining as well. Welcome to our webinar, Exploring our Translation App, Care to Translate. We have learned that many patients struggle to understand the spoken language in the hospital setting, and perhaps you find that being an issue as well. Healthcare professionals may have to arrange for interpreters to come on site and help translate medical information to the patient. Healthcare professionals may also have to arrange for a translation service over the phone at times. And we know that this is not always a smooth experience. We have learned that the translator may not always show up on time. And we have also learned that there are situations when the translation is not 100% accurate. Furthermore, some patients have expressed that they are uncomfortable to have a stranger that is not their healthcare provider know about their medical situation. So we are excited to share with you how Care to Translate can fill some of these gaps today in this webinar. And we appreciate that you're joining us. I have to say, as the Sales Operations Manager, it's also very important for me that I believe in the product that I'm representing. And I can say to all of you today that with Care to Translate, it was very easy to fall in love with this translation app because it's easy to use. And having worked in healthcare for about 18 years, I do see the need for better translations, which is what our app offers. But more importantly, though, is that feedback that I've been receiving from healthcare providers. The app is bridging the gap of communication errors when the language is an obstacle and is making the patient feel at ease. And this is something that makes me really proud when I think about representing Care to Translate. So today we are going to introduce Care to Translate to all of you and show you how it works. We will share customer case study. We will also have an opportunity for all of you to ask questions. And Maya, our CEO, will discuss an exciting offer later as well, and you can see it here a little bit to the right-hand side. So what is Care to Translate? It is an extremely comprehensive medical translator app for healthcare professionals and their patients. And what makes us unique is that each word and phrase that's translated has been verified by native speakers who also have a medical background or a deep knowledge in the medical field. We have over 100 translators from across the globe that will make sure that the translation is 100% accurate, because it is imperative in the medical setting that there are no errors when it comes to translating medical terms. This is a huge advantage over Google Translate, by the way, where we've heard from healthcare professionals that phrases did not translate well all the time and actually caused more confusion. So Care to Translate can be used by any device that you have. And today our app is available in 45 languages, online and offline. So if your hospital has a spotty network reception or is down, our app will continue to work just perfectly. Patient privacy and security is paramount for us at Care to Translate. So no patient or personal information is saved on our platform, nor in the cloud. And here is yet another example of how we are different than other apps, including Google Translate, that actually collects and saves the data in the cloud. You can use Care to Translate throughout the patient journey. When you register a patient at the reception desk, to be able to ask some general questions that the patient can say yes or no to. And that's a really nice way to start, being able to walk into the hospital and right away from the get-go, feeling listened to and feeling heard. And then to continue on to the other categories, as you can see, uh, ask important questions to ensure patient safety, instruct the patient during examination. Let me share with all of you that I just had a meeting at the mammography department at Karolinska yesterday, and we talked about this specific area, in fact, during patient care, how important it is to be understood during the patient screening. It's crucial. The patient is aware about what the next steps are. And the nursing staff explained to me that they only have 3 questions during their screening that they ask the patient and only have 5 minutes to do it. So in their situation, at their department, have you had any breast surgery in the past? Do you feel a lump in your breast? And if the answer is no, they move on to inform the patient to please remove their top so they can go through with the mammography screening. So 5 minutes per patient is a very short amount of time and not a convenient time to arrange for a translator, whether it is in person or over the phone. They also mentioned to me that it poses another issue here for many patients because they do not wish to undress in front of an interpreter. Just like the mammography department, the radiology department, the post-op setting, or any other department in the hospital setting where you may work, where standardized or routine questions are being asked, is just a perfect place for Care to Translate to be used. And the next step is to inform and calm the patient during the entire stay. And I think that's also very important because the patient may already feel anxious going into the hospital, and let alone not knowing the language that the provider is speaking. To feel seen and heard is crucial. And by using Care to Translate, patients have reported to feel attended to during a stressful situation. It's also important to communicate the information before discharge so that they understand clearly the next steps, what they are when they leave the hospital. Again, a sense of comfort and something that we've been able to provide with our translation tool. Care to Translate has been adding some common phrases used in a variety of settings in the hospital over the years, and has therefore built up a comprehensive library. We have about 3,500 phrases now, and this means that you can use our translation app on day one by implementing these templates already made for whatever field you're working in. In addition, you can add your own specific words and phrases to the library if you feel like some are missing and are not part of the templates that we have created. After you've added these phrases, we will verify with our medical experts that it is in fact correct translation for all of the languages that we offer. You can share your list with the entire hospital department, which is really nice. And another added benefit is that by creating this playlist, you essentially create a quality checklist with consistent communication for staff members. So staff members can make sure that certain questions are indeed asked for each patient visit. So here are some practical examples of how it could look like when using our app. Let's use the conversation after the patient has woken up after his or her surgery. Hello, you've had a surgery. the surgery went well. You have a tube in your throat. The tube helps you breathe. Your relatives will come to visit later. Imagine to be able to say these phrases in 45 languages. And imagine being the patient waking up after an operation and knowing that you are safe and you are taken care of. What could be more important than that? For Care to Translate, it is important for us to create an app that everyone can use, no matter the person's technical knowledge. So we're going to look at how we can use the app so that you can see for yourself how convenient and easy it really is. Maja Magnusson, our CEO, will go ahead and demo the app for you right now.
Thank you, Louise. And yes, I will give you a very quick sneak peek how the product looks. I'm showing it on my computer, so it can be used on your computer as well, and on a tablet, on a phone. I'm showing you the template for an emergency room, and as you can see, we have blue icons following the patient journey and also describing different situations that might occur during the patient journey and where you need to inform, instruct, or ask certain questions. You can also formulate different dialogues depending on what role of your team is meeting the patient. Is it the nurse who is doing the examination, or is it maybe the doctor who is talking to the patient? And when I'm opening one of these playlists, you can find a set of phrases that are structured in a certain order. This order can be revised and changed. You can add phrases and take away phrases and use them to translate this content to your patients in 45 languages, as Louise just described. And I wanted to give you an example of the dialogue that Louise just read out to you. So we've created the playlist, Waking Up After Surgery. It includes a set of phrases, and I have set the language for the patient to be German. And to translate, I simply press on the phrase, and the translation will be played in text and sound.
Namaste.
Oh, I'm sorry. I actually had a different language. I had chosen Hindi. Well, namaste. I will change to German in a second to show you how it works in German. But now I can say hello.
मेरा नाम है.
My name is Maya.
आपकी सर्जरी हुई है.
You've had surgery.
सर्जरी अच्छी रही.
The surgery went well. How great. And sorry for the confusion. Of course, I can change the language. And talking to a German patient, I would select German. If the language differs depending on how I speak with a male or female patient, I have to select how the patient is addressed. And now we are back in the German translation. Back in the same list, but now I can speak to my German patient.
Guten Tag. Heiße.
Maya.
Sie wurden operiert. Die Operation verlief gut.
And so on. So depending on what kind of dialogues you want to use and what situation you're meeting the patient in, you can have a set of different dialogues or playlists in the app. Of course, you can always use the entire library. So it doesn't matter if you have added the phrases to the list or not. You can always use the search function. And let's say we are searching for a certain word. I can just enter it, and then I can get examples of the word, but also phrases that might be connected to it. Let's say we're looking for a different phrase. And I wanted to show you this one because you can see there's a small icon next to it. So let's say you want to ask the patient to remove either the trousers or maybe the clothes from the waist up, you can see there's a small image icon. And when I use
die Untersuchung und zeigen Sie sich bitte oberhalb der Taille.
when I use this phrase, I can actually also show an image to support what I'm communicating. Maybe you're talking to a patient who cannot hear well or does not really understand well in the situation. It can be helpful to show an image to support what you're saying. So this was a very short demo of the app, but of course we're happy to show you or give you a bigger demo. If you would be interested in, you can always reach out to us to get a demo of the entire platform and see how you can also adjust the content to your specific needs. And now going back to the presentation, I want to give you some examples of where the app is being used currently in a hospital. And first of all, we're really excited to share that we have over 700,000 people who have actually downloaded and used the app so far worldwide. And just in 2024, we have had new users in over 120 countries. And this has resulted in total in 7.3 million translations so far, which is reflecting the growing need for effective communication in healthcare. And let me give you 3 examples of how Care to Translate is being utilized in hospitals around the world. First, Karolinska University Hospital in Sweden. Initially, they adopted the app in their infection clinic during the Ukraine crisis to meet the increased demand. And the app has now spread organically to other departments, including post-op, or as Louise mentioned, mammography, and also radiology. Then we have Oslo University Hospital in Norway. This is our biggest success story when it comes to implementation in a hospital. So after a successful 6-month trial in selected departments, the decision was made to implement the app across all necessary departments. And now, only 12 months later, it is being used in over 100 departments. This widespread adoption was also supported by a national procurement framework, making the app accessible to all healthcare providers in Norway. And third, Landsspitali University Hospital on Iceland. Here, a 1-year pilot was conducted in selected departments to see where the best fit would be for the app. And before they conducted the trial, they made a global market analysis to see what tool was most suitable. And during that analysis, Care to Translate was selected. And to inspire you, let's look at specific departments using our app. Karolinska Solna post-op department, they integrated the app during a quality improvement project aimed at enhancing communication with non-Swedish speaking patients. And the initiative started with a dedicated nurse, Felicia, who saw the potential of the app and reached out to us. And thanks to her commitment, the app was really quickly implemented and began showing positive results almost immediately. And the fact that Karolinska already was using the tool made it also easy to implement it in this department, helping to discuss pain with their patients and also treat the patient more quickly. Another notable example is Ålesund Emergency Department in Norway, which is part of the same procurement agreement as Oslo University Hospital. The app has been instrumental in shifting their reliance from phone interpreters to our digital solution, and that has been resulting in significant cost savings. They reported saving around 20,000 euros per year. And the app allows the staff to focus on medical care by ensuring clear and immediate communication, which of course is vital in emergency settings. Lastly, the radiology department at Landsspitali has had great success with the app. And they appreciate the simplicity and also the audio feature, which is particularly useful for patients who cannot read. The app allows them to provide instructions in the patient's native language, ensuring understanding and enabling them to perform exams without having to wait for the translator, helping them to save time. This efficiency benefits both the staff, of course, and the patients, saving valuable time. And today we are really excited to be offering this special deal to you and want to give you the chance to have a similar journey as the Landspitali Hospital. So until June the 19th, we are offering you the opportunity to try Care to Translate in up to 5 clinics or departments within your hospital. So you will receive 5 separate accounts tailored to each department for the price of only 1 for the entire first year. So if you're interested, please contact us at info@caretotranslate.com or reach out, of course, to me and Louise directly. And I guess this would be a fantastic chance to improve the communication and patient care in your hospital at a really great value. So handing back to Louise.
On mute. Thank you, Maya, so much. And thank you for sharing that exciting offer as well. We have a little time here now to take some questions before I round off with a couple more slides at the end. And we have a few questions that already came in. I will answer, do you offer free pilot by Christina at the end here in just a couple of minutes. So hang tight. But we have another couple questions here, Maya, if you'd like to take those. The first one is, in which department has this been tested? And which ones does it work well with?
It's a really good question. I mean, going back to the example of Oslo University Hospital, they have implemented in 100 different types of departments. So we have a great variety of content that can suit many different types of needs. But what we can see is where communication is more standardized, the app can be more easily implemented, such as, for example, emergency services or routine visits, or also, for example, diagnostic services such as radiology or mammography exams. We also have a lot of users within the anesthesiology, ICU, and also perioperative care. So these 3 areas I would want to highlight the most.
Perfect, thank you. And how does the response from the patient get translated back so that the staff understands?
Also a really good question. Well, there are different alternatives. On one side, the app is built so that the patient does not need to communicate verbally. So you can instruct the patients to please answer the questions with yes or no, or shake your head or nod for yes and shake your head for no, or do you feel pain? Please point. Where do you feel pain? How many days have you had pain? Please show the number with your fingers. So you really help the patient communicate with their body. But we have also included some answers, standardized answers in the app that the patient can use and click on, for example, to indicate yes or no, or to indicate different alternatives when talking about maybe color of discharge or things like that.
Excellent, thank you. And are there any other questions for now? Feel free to ask them. You can put it in the chat box or raise your hand, but a great question so far.
I think I'm just going to add some customers or people who are interested sometimes have a big number of staff members who might not be native speakers either of the native language, so to say. And here the question would be, can you use the app to translate from many different languages. And I just want to say that yes, that is possible. So you can translate from and to all these 45 languages. So for example, using it in Denmark, you will have the entire platform in Danish, but you could also change the platform to be shown in English or Arabic, for example.
Oh, excellent. And you know, one more question that I've heard as well, Maya, if you can answer that one, please, is can the app be used by many different users in the same account at the same time?
Yes, yeah. So you can be as many users using the app simultaneously in the same account in the same organization. So no limits, yeah, to the users. And I saw that there was one more comment: shouldn't it be interpret and not translate? That's a really good question. So when do you translate and when do you interpret? And I think the app is a solution that kind of touches both worlds, and words, of course. So yeah, I guess it depends.
And they go a little bit hand in hand as well.
Yeah.
There. Yeah. We really hope that you found this webinar helpful. And with Care to Translate, again, you can communicate with all of your patients who speak any of these 45 languages. So it's a very comprehensive tool. You can give better care by effective communication during stressful situations, and you can increase the comfort for patients when they understand and when they feel understood. And that is a very important part as well to make them feel comfortable in the hospital setting. Enable maximum efficiency by maintaining direct and accurate communication with the patient. And I want to emphasize here the word accuracy again, because this is where we feel that we are a better and different than many other translation tools out there, because we have put a tremendous amount of time and effort into making sure that the translations are 100% accurate as far as the language. That is also culturally acceptable as far as the translation goes, and also that the intonation with our text to voice is suitable as well. Spend a lot of time here to make sure that that is the case. If you think that Care to Translate can improve your ability to communicate with your patients, we'd love for you to talk to your organization and contact us. And here comes the answer to the question Christina had: a 2-month free trial, so that you can see for yourself if this is a helpful tool to use with your patients in your department. So we really hope that you reach out to us for this. And you can email us directly, myself here, Louise Savari, or Maya Magnusson, and let us know you're interested to try this out. It's a good opportunity. And also now you have something to compare with from other ways that you have been able to help your patients in the past, which I think is always a good thing. And if you do decide after the trial that we really love this app, this is helpful for us, it's helpful for the patients, we're saving time, we're creating comfort, then, don't forget about the other offer that Maya mentioned, that we're able to provide you with 5 accounts or 5 licenses, but you only pay for 1. So 5 different departments at your hospital can use the app. So mammography, radiology, post-op, ambulance setting, for instance, but you only pay for 1, which I think you should absolutely take advantage of that as well. I think that's it. We are 1 minute over. We appreciate your time so much. Please reach out to us. You can scan this code as well, the QR code, and you can download the app for your individual usage. But contact Maya or myself if you would like to try it in a broader situation with your organization, and we'll make sure that you get the free trial. Thank you so much.
And goodbye.